Okay, welcome to everyone watching and in attendance. My name is Evan Wicklund. I am presenting today with Dr. Tammy Bernasky and Olivia Boonstra. Contributors to this project also include Mah-E-Leqa Jagdal and Cybele Sack. Today we will be speaking about a partnership project called Sustainable Development Goals, a literature review, exploring the transition between inclusive post-secondary education and decent work. First, just a little bit about this project to get us started. In 2022, Eviance undertook this literature review for this overall project. This was a collaborative effort, co-led by St. Francis Xavier University and Toronto Metropolitan University and OCAD University. So there are 5 overarching areas that we will briefly touch upon today. First, we will provide information about the overall themes and demographics, and then we will look at what the literature had to say about positive and negative experiences that people with disabilities have in inclusive post-secondary education and decent work. In particular, we've emphasized on the transition between inclusive post-secondary and experiences of employment. Okay, now I'm going to turn it over to Dr. Tammy Bernasky to talk a little bit about inclusive post-secondary education.
Thank you, Evan. So in our review, we looked at the kinds of barriers that students with disabilities face when trying to access post-secondary education. The review found a number of themes and issues related to barriers. There were social, attitudinal, environmental, technical barriers that can lead to lower completion rates for students with disabilities. So while there are more students with disabilities accessing education, because of these barriers, there are fewer students actually completing university and higher education studies. In terms of accommodations ranged from the accommodations required in the classroom, of course, so things like extra time on exams, stuff like that. Also accommodations around co-op placement, lab work, field work, and work placements. There are complex structures in place that are really driven by the medical model that Evan just mentioned in terms of requiring medical documentation to seek for students seeking accommodations. And so that medical model really drives the accommodation process. In terms of seeking supports, students with disabilities were reluctant to seek supports for a number of reasons. Many of them are overwhelmed by that complex process I just mentioned. Others are worried about the perception that faculty, staff, and other students might have if they find out that the student has an accommodation. There are issues around misconceptions that students with disabilities who have accommodations are at an advantage or have undue advantages because of those accommodations. They also sometimes spoke about wanting to do it on their own. So they want to be able to go through university and not have to rely upon accommodations to do that. There are misconceptions among students with disabilities, students without disabilities, faculty, and staff. So those misconceptions are really quite problematic in terms of the assumption that students with disabilities who have accommodations are getting accommodations that put them at an advantage over other students. Also, there are barriers around accessing funding. So there's a lot of gatekeeping that happens when students try to access additional funding. So sometimes students may require more time to finish their degrees, so they need more accommodations and more time to finish those degrees, but they also need more funding. And so if there's gatekeeping in place, that means that there's also that medical process is in place for students trying to seek those funding opportunities. One of the barriers that also exist for students with disabilities that's also very much underrepresented in the literature is the issue of violence. So students with disabilities are disproportionately impacted by trauma and violence in post-secondary education, but the research in this area is currently limited. So in terms of creating an inclusive post-secondary education experience, we saw with COVID-19 that many of the online learning experiences, many of the learning experiences shifted to online. And so we know that there are barriers for many students when it comes to technology. Some students may not have access to it or they can't afford it. or maybe they live in a rural area and the internet is not good enough to be accessing schooling online. However, at the same time, the pandemic did show us, though, that there are really good possibilities for online learning, and it actually does remove barriers in other ways for students with disabilities. So perhaps they can't come to campus, but being able to access it virtually makes that space more inclusive for them. Student advocacy was another theme that kind of popped out in the literature review. And so creating a sense of purpose and opportunities for the relationship building among diverse stakeholders was really a theme that emerged. Universal design for learning creates more inclusive and accessible learning spaces. But there are challenges around implementing universal design for learning, particularly the siloed nature of academic institutions, which can create barriers to implementation. And so sometimes different departments will have ideas about who's responsible for universal design for learning, and that can create barriers. To create that more inclusive space, you really do need to create an inclusive culture where disability is welcomed. That's a really important part of creating inclusive spaces. Streamlined processes would help students in qualifying for support. So sometimes those processes are complex and different departments don't talk to each other, so it makes it really complicated. So if those processes be streamlined, it would certainly make things easier for students. Training is needed for faculty and staff about disabilities in general, and also the accommodations and what that means. And then more collaboration is needed between faculty, staff, and students so that there's a better understanding amongst everybody in post-secondary education settings about what it means to create an inclusive and accessible learning environment.
Thank you, Tammy. We'll now move on to meaningful employment, and we'll be looking at the challenges and possibilities for decent employment. Okay, in general, many graduates feel, when we look at the areas for improvement, many graduates with disabilities feel that they do not receive adequate supports while attending post-secondary education to prepare them for work upon graduation, and anticipate that they will not be competitive in the job market right off the bat. Limited accommodations. So most people with disabilities believe that relatively simple accommodations could go a long way in making the workplace more accessible, yet many do not receive them. And there are many issues with this, of course. One of the findings was that employees had fewer opportunities for advancement in their roles and had less professional training. Issues of disclosure was a big one in the literature. So many people, graduates who move into the workspace with disabilities, do not feel comfortable asking for accommodations from their employers. Given the infrastructural or attitudinal barriers, this unfortunately comes as little surprise, right? So many workers with disabilities anticipate the stigmatization or just discriminatory attitudes towards them that would come along with even asking for accommodations. And so, in fact, many graduates of post-secondary education feel discouraged to look for work because of the anticipation of discrimination that they may experience. So that's a big one. That was, they're not even looking for jobs some of the time because of what might occur. Job retention and precarious employment is another one. This is especially problematic for workers with disabilities because they may not have opportunities to make stable connections with their peers, natural supports, or their employers, which is a great indicator for success in workplaces. Several authors in our literature search argue that these employment disparities for people with disabilities occur in job retention, wage discrepancies, hours of work allotted, and access to benefits. And these include, this manifests in many ways, but lack of equitable and inclusive recruitment and hiring strategies are common. Ableist assumptions of both employers and coworkers, and just a general ignorance towards appropriate accommodations and disability knowledge. Strategies for inclusion. So now we're moving to the right area of the screen. So employment during post-secondary education was a huge indicator for success once students graduated. So one of the primary indicators for students who graduate to obtaining successful employment is working during their time in post-secondary education. Paid employment during school is such a strong predictor of employment outcomes that students with disabilities that work are more than twice as likely to find paid employment after graduation, which increases if they work in the last couple of years of their schooling as well. There are many reasons for this, but in drawing from the literature, developing this work experience allows students to develop a positive disability identity. It allows them to explore job options, different job career aspirations, and even provides them with the opportunity to build relationships with their employers and their colleagues. Individualistic and holistic practices are also one as a strategy for inclusion in the workplace. So this is another indicator for success. Career supports and services that people with disabilities receive should be ongoing and sustainable. They should be individualized to the needs of each person, and they should address several aspects in someone's life. So this may include not only career services, but also some things like access to public transportation to and from work, help with obtaining assistive technologies, and help with obtaining mental health supports as well. Apologies. Collaboration with employers was also a big indicator. So as we saw with post-secondary education, drawing off of Tammy section, collaboration is also huge. So several authors pointed out that it is important for employers to be receptive, open-minded, and willing to collaborate with employees with disabilities, and have a general overall knowledge of disability, and if possible, implement policies which are inclusive and disability positive, where people with disabilities are not only, the space is not only available to them, but they are welcomed and acknowledged for their skills that they bring to the workplace. Okay, well, I'll throw this to Olivia Boonstra, and Olivia will be talking about the transition from school to work.
Thank you, Evan, and thank you, Tammy. So to continue that, I think, as has been noted by both presenters already, systemic issues have been very difficult to deal with and have persisted for decades. So we're looking at things like inaccessible transportation, lack of affordable and accessible housing, food insecurity, and discrimination were all noted as systemic issues affecting transition planning and employment access. There's also a big issue with income caps on support, which can force workers into precarious working conditions, limit employment options and opportunities, and give disabled workers very little agency over their lives. The literature also has a focus on the deficit model. So a great deal of the literature in the transition space focused on students and workers with intellectual and developmental disabilities. And this focus is important as people with intellectual and or developmental disabilities tend to have worse employment outcomes. However, the research is often stigmatizing, even in recent publications, and often considers IDD from a deficit or medical model. There's also a lack of adult services and support. A lot of services and accommodations end after high school, and many employers cannot or will not accommodate workers to the same level that they may have received before. There's not any government provided adult services in a lot of cases, which means that the gap is often filled by private transition programs that lack transparency about their effectiveness and can be very expensive. There's also some issues with intersectional programming. Many transition programs tend to be predicated on white middle-class values, and very little research in this area considers the intersecting identities of people with disabilities, which is then reflected in programming. So for example, many programs focus on students or workers living alone or away from their family, but this is not the norm in a lot of cultures. Finally, there's some issues with resources and funding. transition support can be quite expensive, and this expense is often taken on by disabled workers. The programs themselves are expensive and often do not guarantee employment, and employers often can't or won't commit to accommodations or assistive technology if they see it as too expensive. So funds and resources need to be allocated appropriately for transition. So some promising things we found in the literature in improving transition from school to work were things like mentorship programs or mentorship elements of programs that help students navigate transition. And the biggest thing they do is they really help with networking, which leads to less time job searching. As has been mentioned, I think by both presenters already, collaboration is really important, especially among service providers and people with disabilities when transition planning and during the transition to create a more accessible system. Programs that are more collaborative can provide more agency and can reduce some of the structural and bureaucratic burdens that come with the siloed approach to post-secondary education. Universal design in programming, just as in learning, is extremely important. Many students with and without disabilities struggle with transition from school to work, and programming open to everyone can be more inclusive and accessible and means that students don't have to disclose their disability in order to get support. Similarly, as has been mentioned, holistic wraparound services for students and families navigating transition. So this includes ensuring that workers and students have access to transportation, communication tools, housing, and food. And again, more paid opportunities for work, especially early in life, can really help attain future success in long-term employment. Intersectional service provision is extremely important, and programming needs to consider the diverse needs and identities of people with disabilities. And it's important that intersectional research continues and that the researchers involved in this research better reflect the communities that they're working with. And finally, employers need to be committed to changing policies and practices to ensure that all employees with disabilities have a supportive and accessible environment.
So just to wrap up, we do have a couple of recommendations as they pertain to changes in inclusive research and changes to policy. So we do recommend, just given our literature review, that, that there should be more research utilizing social model, human rights models, and from an intersectional perspective that really does illuminate and amplify the voices of and perspectives of students and workers with disabilities. And just to really push that idea of lived experience being central. And inclusive case studies that sort of ties into that entire idea of less focus on the medical or psychiatric models of disability, and far more on an equitable approach to disability. And that includes more research addressing neurodiversity, and also drawing on existing literature and community organizations. So less of perhaps an academic approach, and more looking into the gray literature and literature really on inclusive approaches to work and schooling. Changes to policy. We recommend the removal of income caps on benefits and support. We recommend creating policies that inform inclusive design in post-secondary education, more accessible and collaborative transition services or post-secondary education options. So that idea of collaboration was paramount in our review, and change to policies that rely on diagnosis in order to receive supports or benefits in post-secondary education and the workforce and the workplace. So moving from that diagnostic model, the medical model, into more of a equitable, inclusive approach. We thank you very much for attending this session. If you would like any more information about the SDG project, it's very much ongoing. And we have many other projects as well that are ongoing. So please email us at info@eviance.ca and see our website at eviance.ca. Thank you very much for taking the time, and we look forward to your questions.